Welcome back to the Joust About Careers podcast. This episode features the highlights of the conversation with Alexis Beachy, a 2015 Van Buren graduate who is a palliative care pharmacist at Ohio Health. The highlights focus on how a typical day looks for Alexis, the wide variety of settings in which pharmacists can work, the huge role internships and education play in the path to a pharmacy career, and the characteristics of successful pharmacists. If you want to learn more about Alexis's career journey, you can always watch or listen to her full interview. And if you find this podcast useful, please share it with someone else who could benefit from it. Enjoy the highlights, and I'll see you here next Monday for a brand new episode. Have a great week.
Yeah, so for me specifically, I currently cover 5 different hospitals. So since I can't be at 5 places at once, a lot of it is looking on the computer at our electronic medical record and kind of prioritizing patients. So for me, the bread and butter of what I do is any sort of symptom management, whether that be pain management, nausea, constipation, anxiety. Those are the kind of patients that I'm looking at to see what medications are they on, if they're as needed medications, how many times are they utilizing those, and is there anything that our team can do to optimize the medication regimen in order to decrease those symptoms. So day to day, I am not only looking at medications from the computer, but when I'm in person at a specific site, I love to go do patient visits with other team members. So I work closely with physicians, nurse practitioners, nurses, chaplains, social workers, and together our interdisciplinary team really tries to care for patients and their family members as a whole. So I do love to do some patient visits whenever I'm on site, but really the bread and butter of what I do is any sort of symptom management and optimizing medications from that standpoint. So there's inpatient and outpatient. I have experience in both, but currently work in the inpatient setting. So all of my outpatient experiences were through my residency. So inpatient is solely in the hospital. We don't see patients outside of the hospital, but there are pharmacists that have sit in a palliative care clinic. For example, OSU has an outpatient palliative care clinic that works closely with their oncology team. So they're seeing a lot of patients with cancer and doing pain management and nausea management. So I would say the big difference between the two, but other than the setting, is that inpatient, we're doing a lot more aggressive symptom treatment because all of our patients are being monitored. We can be a little bit more aggressive with our medication regimens versus outpatient. It's kind of, okay, we're going to make little tweaks here and there because if something happens, you're not in a setting where we can look at vitals routinely and kind of follow up closely. So I do like being inpatient just because you can be a little bit more aggressive, which in turn allows you to treat symptoms faster. I have friends that did a couple different internships that were, 1 or 2 years long, just so that they can see different avenues of pharmacy. But for me, once I was sold on wanting to do inpatient, it really is beneficial to, I think, stick with one place and kind of build that rapport. And you get to work with people who know your clinical skills and can help you hone in on that. So looking back, it was a long time, but I learned so much within those 5 years, in addition to what I learned in school, that is what I think ultimately led to me being able to get a residency and ultimately the job that I wanted. School definitely felt like forever because you're studying a lot, and studying was definitely something that I had to learn how to do because I realized that in high school, I really didn't have to study much compared to pharmacy school where it was a lot more rigorous. So it was a little bit of a shock, especially those first years or two. So it does take a little bit off of you. It's stressful and it's a lot, but looking back, there's so much to learn in such a short amount of time that honestly, you could be in school for 10 years and still not know every single thing you need to know. So once you graduate pharmacy school, you are eligible to test to become a licensed pharmacist. So for me, after I graduated, I had to take a law exam as well as a clinical exam, passed both of those, and then it is actually optional on whether or not you want to do a residency. So if you graduate from pharmacy school and you earn your pharmacist license, you can start practicing right away at a Rite Aid, Walgreens, any sort of chain pharmacy. Usually, if you want to work inpatient, they recommend that you do at least 1 year of residency. So what that looks like is just year one is very general. So you'll do 12 different inpatient rotations or outpatient, whatever you choose, to kind of get a little bit of a dabble in different areas. So my first year, I did internal medicine, critical care. That's where I had more experiences with palliative care and hospice, which kind of sparked my interest to do an additional year. But very broadly speaking, PGY1 is to train you to be an inpatient clinical pharmacist versus somebody who's standing behind the counter doing medications, or even working like in the pharmacy in a hospital doing more of the operational component. So a lot more like polishing your clinical knowledge and how to interact with patients and providers to make recommendations. And then if you want to specialize, they typically recommend you do an additional year of residency. So anybody that's doing what we call a PGY2 is specializing in palliative care, oncology, pediatrics, emergency med, infectious disease. There's so many different PGY2 options that you can choose from. That's not to say that you have to do a PGY2 to ultimately end up in some sort of specialty, but it does make it a little bit easier if you know down the line that that's what you want to do. So not going through a PGY2, I definitely could have got the job that I have now, but it made me a much better candidate for the position, knowing that I had a whole year of extra hands-on experience within that field specifically. I think looking at my colleagues and the people that I've interacted with the past 9 years, there really is a lot of differences between us. So you can be a successful pharmacist no matter what sort of characteristics you have, but I think ultimately being organized and driven and motivated is a big one, just because in order to get to the point where you're working and you're in your career, it does not come without lots of studying and being very motivated. So that, in addition to being very like patient focused, so wanting to do what's best for your patients and sometimes having to advocate for what you think is right, even though, you know, there may be other team members that are like, no, we really want to do this. You have to be able to stand up and say, hey, you know, I hear you, I hear your concerns, but ultimately I think that this drug regimen is unsafe for this patient. And so for that reason, I'm not going to verify it, and being able to have those hard and crucial conversations, I think, is really important. And if you would have asked me if that's something that I possess in high school, I would have been like, absolutely not, hate conflict, can't do it. But I think that just as you're put in that position through school and through rotations and through residency, you do become a lot more comfortable with it. So it's definitely something that you don't have to have right off the bat, but just being open to learning new things, I think, is also a big one.
If you liked this Joust About Careers episode, you can explore previous episodes and highlights to learn about even more careers of Van Buren graduates. To be sure you don't miss upcoming episodes, please click subscribe on YouTube or your favorite podcast platform so you'll know when the next episode is released. Thank you for spending a portion of your day with us, and we hope you will continue to prepare for your future by learning just about careers.